Would you say that when in doubt, contact your MS team? Professor G, it didn't take long for me to feel like I knew more about my MS than my family doctor. How important is it to see an MS specialist neurologist versus a general neurologist?
You can't really expect a generalist to keep up with all the new information that comes out. And it's not only about individual neurologists, it's about teams of people. So, when you come and see me as an MS expert, you're buying into what I would call a specialist service. And it's impossible in the modern era for a general neurologist to keep up and to do that. Now, I'm not saying there's no role for general neurologists, because in certain parts of the world, there's a shortage of neurologists.
You touched upon the MS team. Who might be on that MS team?
Yeah, so the MS team in the UK, which is probably very similar to other healthcare systems, is the MS expert, the MS nurse practitioner, a neuroradiologist, somebody who reads our MRI scans, and our pharmacist, team that deliver the infusions. We have a physiotherapist who works with just MS exclusively. The other person we have now is a neuropsychologist, somebody who does cognitive testing, and the big part of that individual's practice will be MS. But then outside of that, you've got all the, what I'd call the next tier. So these people will be part of your team, but they won't only see MS. It'll be like a speech therapist, a podiatrist. But you have to have a relationship with that extended team. So I'll give you an example. If you were a patient of mine and you were given alemtuzumab, and you developed a secondary autoimmune disease, we can't expect you to wait weeks or months to be seen. We need to be able to pick up the telephone or drop an email or a WhatsApp, and we would expect our endocrine team to see you literally that week.
I find that the MS clinic nurse is maybe the most valuable part of my MS team, because she serves as a first point of contact, and she can help me get a referral where I need to go and sort of acts as the coordinator of all of that. What can patients do between appointments to help get the most from their time with anyone on the MS team?
I think, self-monitoring is important. And this could be in terms of, I think you do it, is, you do standard walks, for example, and you measure your walking time. You can engage with your pharmacovigilance. So if you're on a disease-modifying treatment that needs routine blood and urine or whatever monitoring, there's no point in just going passively and doing it. You should ask for the results so you can track your own blood results. Obviously, some of the drugs we use in MS are immunosuppressive. It comes with complications. So you need to understand that may put you at risk of infection. So you should take infections seriously. You should be part of cancer surveillance programs, have your regular cervical smear. If the vaccine's coming up, you should engage with the vaccine program. So there's a lot of stuff you've got to do around your general health.
I remember when I was first diagnosed, I was nervous and hyper aware of everything that was going on in my body, but it was very hard for me to know what was a new symptom and what my neurologist needed to know about. How do I know when to just talk to my general physician versus when the MS clinic needs a call?
There's a lot of symptoms that come and go lasting seconds, and they may be irrelevant. And so I would wait to see if they persist for hours to days. They should be new. In other words, you haven't experienced them before, or they've got to be a clear exacerbation of pre-existing symptoms. What we do know is if you've had a previous lesion or an attack involving a particular pathway, that pathway, although it recovers, they never recover back to normal, and it becomes susceptible to fatigue and temperature changes. Now, those symptoms you get to understand, and you don't call those relapses. But if it's something new, then you have to take it seriously, particularly if it's lasting longer than a day.
Would you say that when in doubt, contact your MS team and not the general physician?
I think if you're in doubt, contact them, because not knowing causes anxiety. And then what happens is you fixate on it and you then make the symptoms worse.
Your MS team will often include a specialist MS neurologist, MS nurses, physiotherapists, and others. Self-monitoring and taking an active role in managing our treatment can help us get the most from our interactions with our MS team. If in doubt about your MS, contact your MS team. Thanks so much for watching. For more content on MS, from treatments and diagnosis to mobility and sex, check out the rest of MS 101.